Senator from Oklahoma.
First of all, I thank the Senator from Texas. I yield myself the remainder of our time, which I understand is till 10 after the hour. Mr. President, I want to talk about the taxes here today, which is our subject, in maybe a little different way than some of the others did. The stated purpose of the Democrats' health care proposal is to do two things: lower cost and increase coverage. Now, this bill is a miserable failure on both counts. Under the plan, the premiums are expected to increase as a result of the new taxes, new regulations, and restrictions. In general, you're going to pay more for your health insurance thanks to the Democrats' 2,000-page bill. And this is in direct contradiction to the stated goals of the bill itself. Now, I'm going to be specific about that in a moment. The second issue is coverage. Again, we find a miserable failure. The most often cited number of uninsured Americans is 47 million Americans that would be uninsured. I saw some interesting numbers in the Washington Post opinion piece the other day, which kind of ranks out the uninsured and how they're broken down. Of the 40, this is very significant, of the 47 million, 39% reside in the 5 states of California, Florida, New Mexico, Arizona, and Texas. Of course, those are our border states. Indeed, it's estimated that 9.1 million of the 47 million are illegal immigrants, people here in this country illegally. Now, secondly, of the 47 million, 9.7 million have incomes above $75,000 and choose not to purchase health insurance. This bill would solve that issue by using a coercive power of the federal government to force these citizens to allocate their resources in a manner that meets the approval of the bureaucrats in Washington and of the politicians. The bill makes it a crime not to have health insurance, and if you don't get it, you get taxed. Lastly, a total of 14 million of the 47 million are currently eligible for current government programs, Medicaid, Medicare, S-CHIP, and so forth, and choose not to sign up. Now, if you do the math, that reduces that 47 million down, if you take out the illegals and the others that, for the reasons I stated, to about 14 million. So this, by and large, is what people are talking about when they mention the 47 million uninsured Americans. I think these numbers shed some interesting light on the composition of the number of uninsured Americans that gets thrown around. President Obama, interestingly, uses a different number. He doesn't use 47 billion, he uses 30 billion, and 30 million, because I think he wants to avoid the immigration issue, and I think that's probably wise of him to do that. He doesn't want to be accused of giving rich benefits to people who are here illegally. So he's using not 47 million, but 30 million uninsured Americans. I noted with great interest the CBO's estimate of the number of Americans who will not have health insurance, even if this bill were to be enacted over the wishes of the majority of the American people, 24 million. This bill still leaves 24 million Americans uninsured after spending $2.5 trillion to do just that, while at the same time making health care more expensive for the rest of us. You know, I hear the other side often throwing numbers around without any documentation, and I use the CBO and others non-partisan credible sources so that we can avoid doing that. Now, President Obama wants to spend $2.5 trillion in new health care promises at a time when the country can't afford the promises we've already made, and we have a record one-year budget deficit of $1.4 trillion, which, by the way, means that 47 cents out of every single dollar the federal government spends this year is borrowed. In 10 years, 16%, or nearly 1 out of every $5 that the government spends, will be spent solely on interest payments on the debt. Obama's budget doubles the federal debt in 5 years and triples it in 10 years. We've talked about this on the floor. I don't think there's disagreement on this. On top of this, we face $67 trillion in unfunded liabilities from our current entitlements of Social Security, Medicare, and Medicaid. And all this health care plan layers yet another unaffordable entitlement on top of Medicare and Medicaid and the Social Security and the other entitlements that we have. we're all on a system that's already crumbling. It seems to me this bill is exactly what the American people do not need, and I think that that's why most Americans are reporting that this bill is something that they don't want at this time or ever. I think it's common sense. Now, reading through the legislation, one is struck by a myriad of ways this bill raises taxes on American citizens, from job-creating small businesses to middle-class families. I count about a dozen of them, adding up to about $500 billion in tax increases over the next few years. $500 billion in new taxes. So everyone should get ready to pay higher taxes, higher health care bill, and higher tax bill should this measure become law. And some might be inclined to say, but President Obama promised we wouldn't raise taxes. That was indeed a campaign promise in the administration, and that no one making under $250,000 per year would see their taxes go up. Let me just go ahead and quote that. This is what President Obama said during the campaign, and I'm quoting, "I can make a firm pledge. No family making less than $250,000 will see their taxes increase. Not your income taxes, not your payroll taxes, not your capital gain taxes, not any taxes." So we started analyzing this bill, and guess what we found out? When the bill is fully enacted, the nonpartisan Joint Committee on Taxation, now keep in mind, Mr. President, I'm quoting sources here that are credible sources and nonpartisan sources. The Joint Committee on Taxation found that the average individual making $50,000 and families making $75,000 would see their taxes go up. Let me repeat that. That's families making $50,000 as an individual or $75,000 as a family would have their taxes go up under this bill. And indeed, according to the Joint Committee on Taxation, 42 million middle-class families and individuals, those making less than $200,000 on average, will pay higher taxes in this bill. President Obama's health care reform bill, currently under consideration in the Senate, raises revenues to a large extent on the backs of middle-class Americans, despite the candidate Obama's pledge not to do that. So let's look at some of these instances where we get taxed. I'm getting this again. This is from the Joint Tax Committee and from the CBO. If you have health insurance, you get taxed. According to the nonpartisan Congressional Budget Office, new excise taxes applied to health insurance providers will end up taxing the beneficiaries. This tax also has the effect of increasing premiums as well. So you're double taxed on this deal. Now that's if you do have health insurance. Well, what if you don't have health insurance? You still get taxed. Under this bill, you get taxed if you don't carry health insurance as a penalty. And where does this burden fall? You guessed it, in the middle class America. CBO has said that half of the Americans affected by this provision make between $22,000 and $68,000 for a family of four. That's $22,000 to $68,000 in a family of four. That's middle class America, Mr. President. Now, if you take prescription drugs, you get taxed. Another area. According to the joint, the JCT and the CBO, new taxes in this bill applied to the provisions of prescription drugs will end up raising the cost of those drugs. So you're taxed again. Now, if you happen to need a medical device, this is something I'm very sensitive to and I haven't heard much discussion of this on the floor so far because it's a difficult thing. I was talking to Senator Enzi, and he said people don't really know what medical devices are. The stents, these are things that are available here in America you can't find in many of the other countries. So if you need a medical device, you get taxed. If you have high out-of-pocket medical bills, you get taxed. My son-in-law, Brad Swan, installs pacemakers and defibrillators. I never do say that right. This morning at 1 o'clock, I was talking to him this morning when he told me what happened last night. He said at 1 o'clock they got a call to go out to the emergency room of St. Francis Hospital in my city of Tulsa, Oklahoma, and they had an 8-year-old boy, and he had no heartbeat. He was born with congenital heart disease, and he put in a pacemaker at that time, and he was perfectly healthy in the morning. That's something I think most doctors would agree that child would not have lived. My older sister, Marilyn, faced a similar situation 9 years ago, and she's alive today, and she's healthy today. And she would not be alive today. That's how serious this is. Dr. Stanley DeFair is from Bartlesville, Oklahoma. I talked to him this morning about this thing, about the significance of the medical devices. And I'm going to quote his answer. I wrote it down. He said, "The decision of who needs a pacemaker could be complicated, particularly the decision to put in a pacemaker on someone we might consider quite elderly. But it's false economy to deny putting one in because of their risk of falling, breaking a hip or shoulder. In the case where they fall, the cost would become much higher. The cost of a pacemaker pales in comparison with the cost of a stroke or multiple fractures." A pacemaker, by the way, Mr. President, costs about $5,000 and lasts about a year. That's $500 a year, not a bad deal. And so I think, Mr. President, this is a quality of life issue that we could lose with the Democrats' government-run health care schemes. So those are just some examples of what we can do to pay higher taxes under this bill. If you have health insurance, you pay higher taxes. If you don't have it, you pay higher taxes. If you purchase a medical device, you have higher taxes. If you pay your own medical bills out of your pocket, you have higher taxes. If you take prescription drugs, you have higher taxes. All these activities are taxed mercilessly under this legislation. I want now to turn to examine one tax provision in particular that I find strikingly dishonest, damaging, and expensive to the taxpayer. An additional Medicare payroll tax that's in this legislation is a perfect example of how you get the bill. You have to go into it to find these things. There are clandestine taxes in the bill that will hit you when you don't expect it. Basically, the bill says that people making $200,000 a year are going to pay an additional payroll tax called a hospital insurance payroll tax. That raises over $53 billion. Now keep in mind, this is above the taxes that we're already paying. They're getting these people $200,000. And you might think, well, that's a lot of money. But there's a catch to this, and they didn't index it. So if you don't index the $200,000, then the period of time goes by, it's far greater than the amount that it would sound like today. In fact, I would say that in 10 years from now, that $200,000 would pretty much fit a lot of the middle income people in America. So there's this increase, additional Medicare payroll tax in this bill that raises $50 billion. Is not indexed, and we know how that's going to extend to other people now. I remember candidate Obama making a firm pledge not to raise taxes on middle-class Americans. However, this health care reform bill before us breaks that pledge on numerous occasions. But it's not unlike the new taxes which will be imposed on other measures the Democrat Congress and President Obama would like to enact. I just mentioned the $500 billion in new taxes on the health bill that it raises. There's another tax, another program going on I've talked about on this floor many times, and that is the cap and trade. That's still on the floor. That could come up at any time. And of course, that's not something that would be $500 billion over a 10-year period. That would tax the American people in excess of $300 billion every year. And I quote as my sources there. The Wharton School of Economics, the MIT, CRA, and others have done evaluations. So it's not just this bill, even though this is what we're talking about today. We still have the problem of other legislations that are being promoted by the president and by the Democrats in here, and President Obama's administration's own Treasury Department estimated that a cap-and-trade legislation would cost each family in America $1,761 a year. Now, that's really, it's much more than that in the heartland America. In Oklahoma, it would be closer to $3,300 a year. So we're talking about some very, very large tax increases. But again, back to the health bill, I noted earlier that the government-run health care system, as proposed by the president and by the Democrats, is expected to cost $2.5 trillion on top of the already exploding record deficits. This bill will increase payments we make on our country's ever federal debt, exploding debt. The Democrats' Congress agenda clearly includes more taxes on America, and they may be hidden, but they are there. It's disingenuous, it's costly, and it's another reason this bill should not be passed by the U.S. Senate. I say another. The other reason, and the main reason, is that a government-run health system doesn't work. I yield the floor.